Hello everybody, I'm Dr. Sushal Shantakumar. I'm a consultant shoulder surgeon in Manipal Hospital's Old Airport Road, Bengaluru. So I'll address something which is probably a day-to-day issue to the new generation. So all of us are complaining that the new generation is so impatient and stuff. But then one of the good things to come out of the new generation is they're far more fitter than us. They give far more time for the fitness. Everybody wants to go to the gym. Everybody wants to do a marathon. It's actually good. So let me concentrate on what happens to the shoulder in the gym. So I am a proponent of strength training at all ages, especially if you're in the older age group. So what are the do's and don'ts for shoulder in your gym? So do's, do strengthen your shoulder adequately. Give time for all the shoulder muscles, not just your biceps. Adequate time to your deltoids, your front deltoids, your side deltoids, your rear deltoids, and of course your triceps as well, including your chest muscles. So make sure you have a workout, either you can look it up yourself or with your trainer, which will target all the muscle groups of the shoulder and the chest. Secondly, I think I'm a big believer of high reps rather than high weights. Yes, I can see the attraction in lifting heavy weights. I do recommend you to lift weights, but then to start off with probably something like heavy weight and low reps, it's not something I would routinely recommend. So especially women, especially the younger age group, I think you can start off with light weights and heavy reps, and then of course you can progress to heavy weights and heavy repetitions. So what is one don't that I think I'll recommend after 10 years of a shoulder surgeon? So one of the things is, when you're doing a bench press or when you're doing a squats, try not to lift heavy weights beyond your shoulder. Basically what I'm trying to say is, do not take the weight behind your shoulder, where the weight goes behind you. So this is one of the routine causes for injuries. What really happens is, when the weight goes beyond your shoulder line, you can end up tearing your labrum. We call it the ligament injuries. So this is something I would say not avoid, be cautious about. And of course, give adequate time for recovery. Make sure that you're not overloading yourself. Everybody wants hypertrophy. Give your muscles to adequately recover. I would say around 2 to 3 days in a week is more than adequate. Next thing I'd like to address is, a lot of patients have weakness in the muscles. See, some of them are not able to lift the weight behind the shoulder, such as tricep extensions. Some of them are not able to do shoulder press in one side of the shoulder. The right is stronger than the left. So while some variations are normal, but if this is pronounced for a long period of time, let's say for about a few months, and you don't see any recovery, and especially if the shoulder is hurting when you do that particular movement, I think we need to rule out injury. It might be an injury to a nerve, it might be injury to a specific muscle group, or sometimes it could just be bad form which is not letting you lift up. I think this is when it would be prudent to consult a shoulder surgeon who will probably examine you clinically, and if required, order MRIs and probably clear you, and then you can go back to your gym and start lifting weights again.